It really is. Carry on.
Now, we heard yesterday that GPs are under pressure, and accident and emergency departments have also been in the spotlight recently.
Well, a futuristic new hospital is about to open its doors in Northumberland, and Ewan has been to find out more.
It's been hailed as revolutionary both in concept and design. But can this super-duper A&E only hospital in Northumberland, in fact the first of its kind in the UK, be the much-needed saviour of the NHS, or is it simply mission impossible? Three surrounding hospitals will have a reduced A&E service as the NHS centralises the region's emergency care in this one building. If you're unfortunate enough to need emergency treatment, this is where the ambulance will bring you. Now, at a standard hospital, there's probably around 4 to 6 ambulance docks. Here, there's 14. And then it's a short journey from the ambulance dock to A&E, where there's 36 individual treatment rooms. What makes this design so unique?
From day one, patients, doctors, nurses were at the core of the design process, sat alongside the architects. Things are where they need to be, not where an architect's chosen to put it.
What about those people who may say, listen, this is half an hour longer journey than I'd need to normally go to my hospital?
Absolutely, and certainly for people in the west of our region, that's absolutely true. We'll have a senior doctor in A&E here 24 hours a day. We've got 7 or 8 specialists, consultants working on each ward 7 days a week, 12 hours a day. If you've got an emergency problem that needs a specialist, this is where I would want to be.
So really, it's an A&E department, 48 hours, get them in, get them out.
Pretty much completely that.
With 500 contractors on site, this 210-bed, 3-storey emergency care hospital with 6 operating theatres, built using £75 million of taxpayers' cash, is due to be fully operational by June 2015. So what's the plan with having this central desk here?
So you can see into all of the rooms very easily. So rather than having to walk down a ward and go into each bay, you can stand here and you can see each individual patient, but they can see us, and I think that's a really good thing. And it's quite exciting. It's a new hospital, it's a new build. The staff are really excited about coming here.
And are you confident it's going to work, this setup?
Yeah, absolutely. I think it's going to be really good.
The innovative design has purposely taken patients' needs into consideration. Junior Doctor Will Sweeney, who will be working here, provided us with this information.
It's the first time that I've been inside the building. It's a great space to be able to look around and see everything that's going on in the department all at one time. I'm really excited to start off in a hospital like this that's designed for the care of the urgent and the sick, particularly in an A&E department, which is going to cope really well with those patients.
Despite the benefits claimed by the NCECH organisation, there's opposition from those that fear their local NHS hospital services will pay the price for this North East takeover. What do you aim to achieve by the campaign?
Our aim for the campaign that we're running at the moment is no further downgrading and to ensure that the ambulance services is correctly funded and not downgraded anymore, and making sure that local people can retain a local hospital.
Do you think this is the future, is this the way hospitals will go?
We know that emergency and planned care get in each other's way. Patients expect high quality these days, and that's absolutely right. They also expect senior people to be involved at the outset of emergency and acute care. What we can't do is do that on everybody's doorstep. What we can do is do it in a place with very high standards.
It seems staff here will be up against the clock, and if their mission is to succeed, this A&E hospital will have to keep its promise to give patients the best treatment as quickly as possible.
Well, thanks very much for the preview, Iwan. And the hospital will be opening its doors in June.
Yeah, it looks the part, doesn't it?
It does.
Quite exciting,
It's
that.
massive, isn't it?
Now, Alan,
Yes.
as yet untitled, your TV show, it's
Yes.
on Dave tonight, 10 o'clock.
The Dave channel.
Yes, interesting. But I tell you what, the show itself, for anybody that hasn't seen it, it's a nice little intimate
Love
chat
for anybody who
between
hasn't seen it.
Yeah, but it's true. No,
Both of our viewers
No, don't put
are
yourself
loving
down.
it.
Well, listen, you want to get people to watch it tonight, don't you?
Yeah, 10 o'clock. Tune in. No,
So
it's really
it's
fun.
an intimate chat between a bunch of comedians.
Yeah, we